For decades, Cuban medical professionals have worked in underserved and rural areas, and they've contributed to the Jamaican healthcare system. Their contribution is significant and should not be overlooked. The main issue here seems to be with the terms and conditions of the program itself, not necessarily the doctors or the nurses. Cuban government holds the medical professionals' traveling documents and takes a percentage of their wage. Then Jamaica said, okay, I think we need to upgrade. I think we need to update the terms and conditions. We renewed the contract. It has been 50 years. And Jamaica said, okay, let us update some things. Then Jamaica went to Cuban government. Okay, let us come to an agreement. It's not like Jamaicans just say, okay, stop. We don't want them. No. An international country looked at it and said, the math isn't mathing. This is given forced labor. Although Cuban doctors and nurses would remain in Jamaica until their contract expires, the Minister of Health is aware and it can almost foresee what is going to happen, the workload, and is already making plans and setting plans in place to address that. Like, he is not in denial of the fact that we're going to feel it. So he's setting plans in place, speaking to people from other countries, he's making arrangements. I can't be mad at that. The Cuban doctors and nurses are like over 200. And even in my medical school, when I was in medical school, my class, we were not up to 200. So that is a lot. We're going to feel it. But my hope is that the transition period does not take longer than it should, because burnout is going to go up for nurses and doctors. And we know what happens when burnout goes up. People might quit, people might take leaves. It might just be messy. So I hope the transition period does not take longer than it should. Just give the Cuban doctors and nurses their flowers. They deserve it. They've saved the beautiful island of Jamaica for decades. They're giving their time, their compassion, their care, their advice. 50 years. That is no small thing. So it's important that we give them their praises, their flowers, and we allow them to know that they're appreciated. Because those of us working in healthcare system, we don't get appreciated enough. And that is just a reality. We have to make sure that we appreciate them. So next time you go to your Cuban doctor, or like you go to your Cuban nurse, tell them, doc, nurse, I appreciate you. They are going to remember you for life. Because some of the time, all we get is bare curses and bare fussiness. And hopefully this change pushes the system professionals, doctors and nurses. Hopefully they can appreciate us more and compensate us more. Important to know your local healthcare providers. Research your nearby clinics and hospitals. If your clinic experiences delays, you would know where to go to as an alternative. Ask your friends for recommendations, especially if you're pregnant. To know your nearby maternity clinic, a place that can afford to go to. Is the place closer to your workplace or is it close to your house? You want to start doing these things early because you don't want to miss out on your maternity clinic. Patient during this transition, they've said this is what is going to happen. I mean, it is sad, but just accept the reality and be patient, understanding, respectful to nurses and doctors, because we are not the ones that made the laws. We are literally not the ones. In fact, we are the ones to feel the effect the most because of the workload will fall on us, and we have to manage it while remaining empathetic and providing the best care possible. To highlight the fact that you should take care of your health, guys, eat properly, drink water, take your medications, avoid alcohol, avoid stress, avoid smoking. These little things can compound into a better health. Yes, because you might not need to go to the clinic, you might not need to go to the emergency department. The healthier you are, the less urgent care you need. Have an emergency plan. Know your nearest hospital, know your nearest clinic, know their opening times, know where to go to in case of an emergency. Plan to use telemedicine when possible. It is 2026. I think we should start being open to the idea. Not a lot of people use it, but I think we should be open to the idea because the wait times at clinics might be crazier. It is already crazy, but it can be crazier. No. Virtual consultations should be encouraged. This can be a call, a WhatsApp video, a Zoom call to review lab tests, to review your health, to review your symptoms. It makes it convenient and comfortable for you and the doctor. For follow-ups, use it for routine checkups. When doctors and nurses live in, the wait times can be outrageous, especially in the rural areas. Telemedicine gives you professional advice without the need of you leaving your home. And it keeps your health in check while the clinic adjusts. And that is just the reality. Let's say that instead of you waiting the whole day to be seen at the doctor's office, and I empathize with you as a doctor, I can't imagine myself waiting at the doctor's office for the whole day. I completely empathize with you. And now I think the wait times are even going to be more because of the staffing, because of the doctors leaving. So it can make it convenient. The thought of me waiting at the doctor's office the whole day can be so discouraging. In fact, I might not even go. I might say, you know what? I'm not about to stress myself. It's not that deep. I'll just stay in my yard. So that is it. You can stay in your yard and stay to your doctor. For instance, let's say that you live in St. Anne and you have to travel to your gynecologist, or you have to travel to ophthalmologist, or you have to travel to your name it, whatever doctor you see in Kingston. You say, you know what, let me just have the consultation online. St. Anne, you're communicating with your doctor in Kingston. It makes life comfortable. Know your insurance coverage. If you have a private insurance or if you use the NHF card, check what services and medications are covered. Be meticulous about it. Do your research. Limit your copays, your approvals for certain treatments, medications, and just know what your insurance covers. Why this matters is because with the Cuban doctors and nurses leaving, you need appointments with new doctors in new clinics, which can sometimes mean private care. Knowing what is covered prevents you from paying unnecessary bills, and it helps you save and plan ahead financially. It's important that you keep your mental health in check. I consider myself a mental health advocate. I love the idea of making sure that mentally we are sound, not just physically and what looks good to others, but mentally we are doing okay. So this can be a stressful time. This can be an anxiety-inducing period, especially if you have chronic medical conditions, if you've been seeing your doctors for decades. I can imagine this is a stressful time. I would be stressed too. Don't feel stressed, okay? And if you feel stressed, talk to a professional, talk to a counselor, talk to your doctor. Maybe your doctor can find a way for things to run smoothly for you and set actions in place to ensure that you are not infected by the change or by the transition. It is completely valid to be unsure because our brain does not like change. Our brain loves to stay in the familiar zone. I understand that. Your feelings are valid. It's important that you trust your medical professionals. That Jamaican trained doctors and nurses are well equipped. They are educated, they are licensed, capable of continuing the high quality care. Let us build trust with our locally trained medical doctors and nurses.